I'm going to be sharing the highlights of our July 6th event that was held in Geneva, Switzerland. The event was entitled Promoting Mental Health in the Context of Global Public Health. And our event was organized by KIBS with the co-sponsors of Congo, Ibrea, and UN NGO Irene. It was a really very well-received seminar, and we had a wonderful panel of speakers and over 70 people that attended, which included UN staff, UN representatives from permanent missions, UN agencies, the NGOs, professionals, educators, scientists. And it was focused on mental health, because that was the issue that the UN was focusing on last year. Mental health has become a major burden globally. The event covered the interrelationship of mental health and global public health. We spoke about modifiable factors and cost-effective interventions, and successful cases and global partnerships in the promotion of global public health. Whenever discussing mental health, I like to refer to the World Health Organization definition, which Dr. Mazui also just had. Mental health is the state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to contribute to his or her community. And mental health is affected and related to behavior, socioeconomic factors, environmental factors, and sustainable development. I'm going to briefly summarize the speakers that were at the event. The first speaker was Dr. Janet Woods-Wetzel, the main representative for the International Association of Schools of Social Work, and she spoke on mental health in global public health and development. And she made it clear at the beginning that hundreds of millions of men, women, and children are suffering from mental illnesses. And she had highlighted some social and economic-based programs around the world which are making differences in the lives of those that are mentally ill. She had used social firms in Europe as an example, and these social firms are set up to provide employment for people with mental illnesses. And they work very well because they're important in giving these people a reason to find meaning in their lives. Next, Ms. Saïda Agredi spoke, and she was the president of the Tunisian Mothers Association and regional coordinator of the UN NGO Irene. And she spoke on the role of African NGOs in prevention and public health, and she stressed the importance of reducing child and maternal mortality rates. And she had said it was very important to use the IEC approach, which is informing, education, and counseling, and this was necessary for the women with pre- and postnatal care. And she summarized by saying that we are all stakeholders of development, and that we, the government, the private sector, civil society, academia, and the media, must implement the MDGs by increasing health literacy, promotion, and education. I spoke next on education and mental health. And I emphasized the interrelationship between physical and mental health, and the importance of creating conditions which would facilitate this in all ages, starting with infancy all the way up to old age. I explained the principles and programs of brain education, and I explained how the 5 essential steps of brain education are based on hardcore neuroscience, neuroplasticity, and neurogenesis. Brain education is designed to promote physical well-being, mental emotional well-being, social well-being, and higher achievement. I discussed the positive effects of the brain, of exercise on the brain. I explained how BE regulates our body's natural stress response, and I spoke about brainwave vibration. I concluded that brain education increases one's self-esteem, improves communication skills, reduces violence, and reduces harmful habitual behaviors such as drinking, smoking, drugs, overeating. On a global level, brain education is dedicated to the betterment of humankind. By having individuals that are healthier, happier, and more peaceful, the world would be a better place. At this meeting, I was able to introduce something very important to us, the Brain Alliance Initiative. This was an effort for Ibrea and KIBS to really take action at the United Nations. And this is an alliance of individuals and organizations with the goal of promoting awareness about the importance of the brain. We at Ibrea believe that understanding our brain and using our brain best is the way to solve humanity's problems. Our first meeting was held on August 15th prior to the Brain Art Festival, and our second Brain Alliance meeting will be held today following this seminar, and I'd like to invite any of you who are interested to please join us for the meeting. speaker was Dr. Kendall Poe, who was the director of eHealth Strategy Office and the Faculty of Medicine at the University of British Columbia. And he spoke on technology-enabled public health. And he was a wonderfully animated speaker that everyone thoroughly enjoyed. And he spoke about technology and how we're all connected, and it's so easy to be connected because of the internet and video conferencing. He used the term glocal and spoke about the synergy between local and global public health. And his conclusion brought a roar from the audience. No one can whistle a symphony. It takes an orchestra to play it. And again, this emphasizes we all need to work together, and because of technology today, we all are able to work together. Mr. Liberato Bautista, the president of Congo, spoke next. And perhaps the most important thing that he had said, which really hit me, was that he suggested that health of the people is the wealth of society. Common wealth may be reworded as common health. Then Dr. Torkel Klingberg, who is a professor of cognitive neuroscience from the Karolinska Institute in Sweden, spoke. And he gave a fascinating lecture, especially to me as a pediatrician. It focused on ADHD in children. And he explained the symptoms associated with ADHD, which is the most prevalent childhood psychiatric condition worldwide. And he spoke about working memory, as Dr. Goldberg had mentioned. And working memory is one of the psychological functions that is implicated in ADHD. And he presented a computer-based method for training working memory. And had stated that it was found, research across a variety of populations showed that children could improve their working memory. And they also could improve their symptoms as well, which was shown by parents and teachers taking the survey. Amazingly, the effects of this training was shown to last 6 months. And they also had studies that showed physical changes in the brain itself after doing the training. So his conclusion, which really is applicable to IBREA and our brain tests and everything that we are focusing on, is that cognitive training is a promising venture and it can have an effect on mental health globally. And our final speaker, the keynote speaker, to whom I cannot compare, is Mr. Ilchi Lee, the president of KIBS. And he spoke on global partnerships for strengthening mental health. Mr. Lee began by leading all of us in simple exercises to relax the room and bring up the good energy, which it did. He described difficulties that he had as a child struggling with ADHD-like symptoms and his search to overcome hopelessness and the despair he felt. He described results of his own brain imaging, which had shown problems in his frontal lobe, and yet how due to neuroplasticity, he's able to be successful. And this has given him hope for the potential of the brain. Mr. Lee suggested that problems for individuals, including issues of mental health, are problems of society. He suggested the need for new values, a new culture, and a new world. He discussed brain education as a method to help individuals use their brains well and explain the way brain education is shared. Programs have been implemented around the world in schools in Korea, in the United States, in Canada, homes for the elderly, correctional facilities, military services, healthcare settings, work settings. We have the University of Brain Education in the Republic of Korea, and now our online university. And Mr. Ilchi Lee had concluded with introducing a new website, which now is up and running, brainworld.com. And this website is designed as a forum intended to foster new values, a new culture, and a dream for better humanity and the world through helping people to better understand the use of our brain. And I'd like to reiterate what has been said earlier today. The brain is the most powerful resource available to humankind. If we all use our brains to pursue health, happiness, and peace, we will make life more meaningful and more beautiful for ourselves and for our children.